Today, we are going to see that how important in One Health, the laboratory and as well as a biosafety. All of you agree that in the laboratory, we have to take care of the personnel who are there inside the laboratory. That is staff safety. Apart from the patient safety, we have to take care of the staff inside the hospital. If you go to any department in the laboratory, either in the microbiology, pathology, or biochemistry, you should be very careful that you are not supposed to touch anything because there are many samples which are very infectious. So I'm going to talk about how you can take care of yourself and also the biosafety, how important and when you are dealing with the microorganism. This is the role of biosafety and laboratory in the One Health framework. Just now you heard our Dr. Venkatesh Tuppil has talked all about One Health. Now we'll apply those things in the laboratory where biosafety plays a major role. Biosafety and biosecurity measures in the laboratory are essential for protecting our personnel, our fellow colleagues, the environment, and the public from potential hazards associated with biological materials. You must have seen the symbol which is put in the laboratory outside, that is the door, that a biohazard symbol will be there. Any person, whether he is in the hospital, whether a doctor, a nurse, or a technologist, not supposed to enter if there is a biohazard symbol. It applies to other people also. Whenever the patient comes for the report, not supposed to enter because there, even though you take lot of measures to control inside the laboratory. One should be very careful about this. Next slide, please. There are important things are risk assessment. Laboratory should be designed in such a way, and personal protective equipment. All of you know that how important we have to wear certain things inside the laboratory. And you should know that we have to assess the risk before starting the laboratory, before entering the laboratory, or the laboratory personnel should know what are the risks involved in this. And also the laboratory is designed in such a way. That is why any hospital or a laboratory, when it is designed, we need engineering support. Engineers should come, and we should also give them a particular design, how we have to make a laboratory, how it should be there for the importance of the biosafety and other things. Next slide, please. The biosafety measures, what are those? We should have standard operating procedures or the protocols. All documents should be there. We cannot just orally give the training and other things, but you should have that document placed in your place, that is develop and maintain SOP for handling all biological materials. All biological materials are very infectious. Regular training and retraining and update for staff on all the standard protocols, whatever you have prepared. Then decontamination and waste disposal. Nowadays, it makes a sense that biomedical waste management should be followed in all the places, unless and otherwise you are not going to get the particular license for the laboratory. Implement protocols and decontamination processes. Then go for the emergency procedures. Establish clear emergency response plans for spills. Spill management kit should be there. Whether it is a blood spill management or a mercury spill management should be followed inside the laboratory. Conduct regular drills and training for staff is very important. Next slide, please. Now you can see there are about 4 levels in biosafety. The first and foremost, you see the biosafety level 1, and then you can see the pyramid 2, 3, 4. Here you can see a lot of organisms which are put inside in the biosafety level 1, which may not be very, very hazardous, but still it is infectious. Go to the biosafety level 2, you see certain organisms like Burkhold filaria and then Salmonella, which are there, which you have to take more caution about that. And then you go to biosafety level 3, where microbes are even more dangerous Yersinia pestis and other organisms which are there. And then biosafety level 4 is the ultimatum. We had to take care unless and otherwise you have various personal protective equipments which are required for biosafety level. That is examples, Ebola virus and various other deadliest organisms. Next slide, please. So biosafety level 1, let me take that. Microbes not known consistently to cause disease in healthy adults and present minimal potential hazard to the lab and also to the environment. What are those organisms? Example, non-pathogenic strain of E. coli. Even there are strains which are there like E. coli, Klebsiella and other things, but in the biosafety level, still you are safe. Next slide, please. Coming to the practices which you should take, standard microbiological practices are followed. Work can be performed on an open table or bench. Personal protective equipment, of course, needed. Sink is important for hand washing. Lab doors are separate. Next slide, please. In the biosafety level 2, the microbes that possess moderate hazards to laboratorians, example, Staphylococcus aureus. Of course, there are other things like the Staphylococcus methicillin-resistant Staphylococcus aureus. The practices which you have to follow inside the laboratory, those are also very stringent measures. Otherwise, you will land up in trouble. Next slide. The biosafety level 2 practices, access to lab is restricted, then work is being conducted during the processing of the samples and other things. One should be careful. Personal protective equipment again required. Face shield is important, and eye goggles. It's one of the criteria should be there when you are taking care of biosafety level 2. And then biosafety cabinet plays a major role here. And different types of biosafety cabinets are available, which has to be followed for this particular level. Autoclave separately for sterilization and separately for decontamination purposes should be there. Self-closing doors. The door closing should be automatic. It should not be just when you open, it should not get open for a longer time. Then sink with eye wash apparatus readily available. Next slide, please. In the biosafety level 3, you see the serious and lethal diseases through respiratory transmission. Because we are all breathing. When we are breathing, a lot of organisms we can inhale and other things, so that the personal protective equipment is very important, and especially example for Mycobacterium tuberculosis, which is a dangerous organism, and even till now we are not able to eradicate completely. If you go to Western countries, we don't see Mycobacterium tuberculosis, but in our country it has become a deadliest problem all over the country. Next slide, please. So for the biosafety level 3 practices in the laboratories, under medical surveillance and receive immunization. What are the immunization programs you take for the staff who are vulnerable to the infections? That is, hepatitis B virus is a dangerous thing. You can prevent cancer by taking the vaccination of hepatitis B virus. That means it is going to cause the liver cancer and also serum hepatitis. Those can be prevented, and it is mandatory now for all the laboratory personnel and all the hospital. So the hospital personnel should undergo this vaccination. This is one of the criteria to take up when you go for accreditation and other things. Then please go back to the previous slide. Yeah. Then personal protective equipment with respirators are very important. Sink with eye wash. It is a mandatory thing. Then exhaust air not recirculated inside the laboratory. Then self-closing doors with automatic locking. Automatically it gets locked when you go out or when you enter inside the laboratory. That is about the biosafety level 3. Biosafety level 4 practices are very important. You can see the person like the one who is going to the space, like that he should be. There are a lot of biosafety level, these things are there. Even at our center, biosafety level 4 when H1N1 came, that we all followed this. And this is a very important aspect as far as the present day infectious diseases day to day we are seeing that is concerned. Next slide, please. So in the biosafety level 4, the highest level of biological safety, each and every person is not allowed. Only authorized persons are allowed inside the biosafety level when you are taking. It is a separate P4 laboratory like that. It can be installed by bringing from outside, and then the area should be there and everything is covered. And then personal protective equipment is very important to enter this particular level, biosafety level 4. Then the dangerous and exotic microbes. For example, Ebola virus, all of you must have heard about Ebola virus. It started sometime back in African countries. The both technologist, patient, and the treating doctor, all of them will get, completely compromised because of this Ebola virus. When they come in contact with the patient sample and the patient, then all the three are out. So that is why in the biosafety level 4, one should be very careful. All the general people are not allowed. Only trained people, trained for so many days. After the training, they will be given that they have to go and work inside. Once you start working inside, you're not supposed to come inside, outside without any permission. And when they go inside, they have to sign and go. When they come out also, they should sign, and then they have to take certain protocols which are very much important. Next slide, please. So biosafety guidelines for laboratories, in summary, mouth pipetting is not allowed, and wherever food and water which are not allowed inside, and they are not supposed to eat anything food inside the laboratory, and then not supposed to drink. Then laboratory coats are obligatory and should be removed when exiting the lab. Working surfaces must be decontaminated using soap and alcohol for each working day. All of you know how important the hand washing and other things. Nowadays, hand washing, hand rubbing, and other things are very important for the laboratory personnel or the nursing personnel who are there working in the hospital. Then waste products must be decontaminated by incineration or by autoclaving. It's a must. Whenever you are sending your waste products and other things, should be autoclaved and sent, especially the microbiology products. What are the wastes which are generated in the microbiology? Frequent hand wash is obligatory. Laboratory doors should be closed at all times. And biohazard warning signs should be always posted in labs. These are the important measures of biosafety guidelines for laboratories. Next slide, please. So this is about the biosafety level, which you have to take care whenever you are entering the laboratory. For all, the take-home message for everybody is see that all laboratories takes up biosafety levels. Thank you very much.
Thank you very much for that illuminating talk, sir.